It's been such a blessing just getting to see so many people come through. I had no idea it'd be this many people, and some of them saying they hadn't seen a doctor in years or their tooth has been bothering them for months, and just crying just with gratitude has been overwhelming. It's been really cool.
Fabulous day. We were overwhelmed by the amount of volunteerism and the true gratitude that all the patients that came to see us had for the ability to get this health care in a timely manner, free with high level of expertise.
You know, the original concept of this remote area medical organization, or RAM as it's called in its acronym, was born in the third world, on the Brazilian frontier of Guyana, or what used to be British Guiana in South America. And I was a young vaquero, or cowboy, where all the cowboys were Indians, except me. And they gave me a wild horse to ride, a horse called Kang. Kang was a Wapishana Indian name, meant the devil. And apparently Kang had already killed 2 other cowboys. So anyway, we captured Kang and saddled him up, and I climbed on board, and we went bucking across the savannah, and we had a head-on collision with the side of the corral. I was very badly injured. And one of the vaqueros said, well, the nearest doctor is 26 days on foot from here through that narrow trail in the rainforest where you couldn't take a horse. And, well, I managed to survive, but I thought, well, maybe we need to bring these doctors a little bit closer than 26 days on foot. And so that's where the idea was born. And of course, it started out as taking health care to third world countries, an airborne operation. We have the capability to parachute into places when we have to. But then, right here in the United States, we started getting inquiries. The first one was from a place called Sneedville, Tennessee, in Hancock County, Tennessee, you know, one of the poorest counties in the nation. And they just closed their hospital, and the dentist they had left town. And so we were asked if we'd go up there and help out. So that was the first one here in America. And now something like 789 of these expeditions, as we call them later. Here we are in Sarasota, Braden, Florida. And well, this morning we gave out 800 numbers. There were people that were here 24 hours ago waiting for one of those magic numbers to get the care that they need here in the world's richest country. In fact, the World Health Organization, in its listing of 160 countries and how they provide care for their citizens, the United States is ranked number 37. Shouldn't be that way. It should be number 1. We're number 1 in the technology, in the sophistication of the care that we can provide, but we're certainly not number 1 when it comes to affordability. And so you have something like 40 million Americans maybe that can't afford to go to the dentist, can't afford to go to the eye doctor and get a pair of glasses so they can function. And so we've been filling what niche we can for those folks here in America, and 90% of what we do now is here in this country. But we can't forget the rest of the world. And these are terrible times when, whether it's global warming or the El Nino off the California coast, but we're having some really serious weather phenomena with these massive floods, hurricanes, and typhoons around the world, and earthquakes. And now on top of that, we've got the other ominous human factor, the threat of terrorism coming to our shores, as it already did, of course, on 9/11. And so I want my organization, Remote Area Medical, to be ready to help deal with these disasters, whether natural or man-made, and because they're coming. We need to be ready.